Thank you, everybody, for joining us. My name is David Griffith, here with the Elder Initiative at William Way. Welcome to today's Doctor is In program. And as you see, we are talking about diabetes today and are lucky to be joined by Dr. Molly Alanoff. I'm sorry if I'm mispronouncing the name.
No, that's good.
All right, Dr. Molly.
Yeah.
Who I will turn things over to in just a moment here. For any of you who are new to our Doctors in programming, this is a partnership between the Elder Initiative at William Way and the Jefferson Department of Family and Community Medicine, as well as the Jefferson Center for Healthy Aging and the Center for Community Health. And we are pleased to be able to offer these monthly health programs to give an opportunity for folks in our LGBT older adult communities to get this important medical information and to ask questions of their medical providers. Just a couple of quick housekeeping things. You are welcome to ask your questions at any time during the program, either through the chat feature or through the Q&A. Things that you send through the chat do have your name attached to them. There is an option when using the Q&A feature to ask your questions anonymously. So if you have anything that is more personal that you don't want your name attached to, use the Q&A feature and check the box to say, ask your question anonymously. But other than that, I will turn it over to you, Molly. Thanks so much for being here, and you can take it away.
Yeah, thank you guys for having me. And like David said, you can feel free to interrupt with questions at any point via the chat, the Q&A, or even just unmuting yourself and asking. And it looks like I see some familiar names, but once I switch to my screen so that I can see the presentation, I won't be able to see the chat. So David, if there's anything in there, just let me know. And we are going to talk about diabetes today. So what is diabetes? Does anyone who is familiar with it want to share their definition of diabetes or what they think is the definition of diabetes? I am happy to define it. They are just some words that people tend to associate with diabetes, things like glucose, injections, insulin, pancreas. We think about hyperglycemia, meaning high sugar. And I'm sure other people have a lot of other associations because it's such a common disease. So I'm not sure why this is blurry, but diabetes is a disease that results when the body has too much glucose in the blood, glucose meaning sugar. And here are just some food items that we think of as having sugar in them. Some of them are more obvious than others. So we have raw brown sugar. That, of course, is going to have a high sugar content. Fruits and vegetables, those things are not as obvious, but they do contain sugars. Pizza, you don't necessarily think of that as being a sugary food item, but the bread has a lot of carbohydrates in it, and carbs are sugars. And then the more obvious things like ice cream, candies, cookies, things like that. Insulin really plays a key role here because insulin is a hormone that our bodies make. It's made in our pancreas. And when insulin is present, the glucose or the sugar can move out of the bloodstream and into the cells. And like we said before, the disease process happens when the glucose is in the bloodstream. So you can think of glucose and insulin working in kind of like a lock and key fashion, in that the cells all have a lock on them and the glucose can't get in on its own. But if it has the insulin, which is a key, it can get into the cells no problem. So that's why insulin is so important. So here's just another way of looking at that. So you have your pancreas up here, and the pancreas is like a smallish organ kind of in the back of your abdominal cavity. It has a lot of different kinds of cells, and it has cells that produce and secrete insulin. So when it makes the insulin, it releases it into the bloodstream. it kind of finds the glucose and it helps the glucose get into the cells, either a liver cell or a muscle cell. So those are the steps that we just talked through. And then once the sugar is in the cells, that's where it can be converted into energy, and we can store it in either the liver or the muscle, whereas in the bloodstream, it's not really of any use to us, and it is in fact dangerous. Anybody know of any kinds of diabetes? There's a few. So there's type 1 diabetes, which is far less common. There's type 2 diabetes, which is probably what most people are more familiar with. There's gestational diabetes, which is a form of diabetes that develops during pregnancy. And then there's pre-diabetes, which we'll talk more about later. And there are even more types in this, but these are the most common and the most common in our country and in other countries as well. So type 1 diabetes is what you've probably heard of as juvenile diabetes that develops in childhood or adolescence, and that's only 5% of diabetes cases worldwide, and that's an autoimmune disease, meaning that the body's immune system attacks the pancreas and attacks those cells in the pancreas that produce and secrete insulin. And when you don't have any insulin, there's no way for your body to get that sugar into the cells to use for energy. And this is a type of diabetes that's not at all preventable. It's inherited. Whereas far more common, about 90% of diabetes cases worldwide, is type 2 diabetes, which we think of as being adult onset. There's a strong genetic component here as well, meaning that if you have a parent or a sibling who has type 2 diabetes, you are far more likely to develop type 2 diabetes. But it unlike type 1, it is preventable. And in type 2 diabetes, it's not that your body is not making insulin. You can see in this drawing here, the pancreas still makes insulin. The insulin still gets to the bloodstream. But for various reasons, the cells are not accepting. It's almost like if the insulin is the wrong key, and your body becomes more and more resistant to the insulin that you are making. Whereas gestational diabetes is also preventable, and it is triggered by hormone changes that are experienced during pregnancy. And developing developing gestational diabetes definitely puts you at an increased risk of later developing type 2 diabetes. And about half of people who have gestational diabetes during pregnancy will end up being diagnosed with type 2 diabetes later on. And then pre-diabetes affects about 30 to 40% of people throughout the country, and it puts you at a significantly increased risk of developing diabetes. What's important about prediabetes is that not only is it preventable, but it's reversible. So being diagnosed with prediabetes does not mean that you're going to end up having diabetes. It means that you need to, think really closely about lifestyle factors like diet and exercise, and most people are able to reverse that with some hard work. And you don't have any symptoms when you have prediabetes. So 9 out of 10 people who have prediabetes don't even know that they have it. So why is it dangerous to have all of this sugar in the bloodstream that we can't get into cells? The reason is that when you have all of this sugar just kind of floating in the bloodstream, floating in your blood vessels, it can cause pretty significant damage to those blood vessels. So there are some common symptoms of diabetes, and these are all the result of having too much sugar in the blood vessels. So you might have blurred vision. You could feel hungry all the time, and that's because even though there's sugar in the blood, it's not getting into the cells, and so you're not able to use that sugar to, have energy. People feel thirsty all the time because having high sugar levels in the blood can make you pretty dehydrated. You tend to pee a lot as a way to get rid of that excess sugar. And some people have weight loss because they're just not able to convert any of that sugar into anything usable. With uncontrolled diabetes, you also tend to get you have a really hard time healing wounds. And over time, if not treated properly, you can get neuropathic pain, it can be pretty severe, tingling in the hands and feet, or other parts of the body as well. And there are several things that put you at risk for diabetes. Being overweight is a big risk factor, and so is leading an inactive, sedentary lifestyle. Being older than 40 is increased risk compared to someone who's younger. Having a parent or sibling with diabetes, like I said before, having had a history of gestational diabetes, which we just talked about. And then the other things that put you at risk are having prediabetes, having high cholesterol, and having high blood pressure. So when we think about complications from diabetes, there's two main kind of branches that we think about. The first one is microvascular complications, meaning damage that's done to the really small blood vessels in our body. And these things can happen early on in the disease course. So if having excess sugar in the blood vessels of the eyes if that's happening for too long, you can get something called retinopathy, meaning that the blood vessels of your eyes are damaged from high sugar. And if we don't start treating the diabetes at that point, that can ultimately lead to permanent vision loss or blindness. And so what we do about that in someone who has diabetes, your doctor will probably recommend an annual retinal scan, where a special camera kind of takes a picture of the back of your eye to look at the retina and to see if there's any blood vessel damage that's already developed. Another microvascular complication that we want to avoid is kidney damage, because there's a bunch of blood vessels that go right to your kidneys, and if those vessels are damaged, you're not able to get proper blood flow to your kidneys, and that, if untreated, can ultimately lead to chronic kidney disease and end-stage kidney disease or kidney failure, which is treated with dialysis. And so in patients with diabetes, we check their kidney function regularly, and we also check something called microalbumin, which is a test in the urine that lets us know if there's any protein in your urine. And if there is protein, that kind of gives us a clue as to the fact that there might already be some kidney damage from the diabetes. And the last microvascular complication that's pretty important is neuropathy. And the reason we worry about neuropathy or nerve damage especially in the feet, is because if you do have nerve damage, you're not going to be as sensitive to injuries or cuts or wounds in the feet. And if you're not aware of those and not treating those, then they can be really, really hard to heal and can ultimately lead to problems that could eventually result in losing the affected limb, which is something we definitely want to avoid. And so that's why we recommend patients with diabetes seeing a podiatrist regularly, which is a foot doctor. And then the other broad category of complications from diabetes is the macrovascular complications. So things like stroke and heart attack, and just overall poor blood circulation. And this is similar to the microvascular complications. It's just that instead of it affecting the small blood vessels in your body, the excess sugar has negative effects on the large blood vessels on your body, like the vessels in your brain. And if those get damaged, that's when we worry about a stroke. And the vessels that supply blood to your heart, and if those are damaged, that's when we worry about a heart attack. And so kind of depending on where your diabetes is and your other health conditions, you and your doctor can come up with a plan for the best way to monitor your diabetes. Not everybody has to check their blood sugar at home. It really, is a more individualized thing. And normal blood sugar in the morning is usually like less than 140. So meaning you haven't eaten anything. And then with things like prolonged fasting or eating or exercising, there are kind of expected fluctuations in blood sugar. So in the morning, it's probably the lowest it'll be all day. Then you eat breakfast and your blood sugar spikes up. It comes back down. It goes up a little bit with a snack. It goes up more with lunch. And it kind of, goes up and down throughout the day. And that is totally normal. What we worry about is when it's spiking too high or too low. That is a sign that the diabetes is not well controlled and that medications probably need to be adjusted. And for people who do check their sugar at home, they use a little lancet to prick their finger. And they put that on a little piece of paper and into this glucose monitor, which tells them how high their blood sugar is. And there are other ways of checking blood sugar as well, especially in people with type 1 diabetes. They'll sometimes have a monitor that they wear that checks their sugar continuously, but this is far and away the most common way of checking blood sugar. Another important thing that we use to monitor diabetes is called a hemoglobin A1c. This is a lab test that your doctor will order, and it shows kind of how the average amount of sugar in your blood over the last 3 months. So normal is an A1c less than 5.7. Between 5.7 and 6.4, we call that prediabetes, meaning your risk is pretty high, but it is reversible and it is preventable. And then above 6.5, that is consistent with a diagnosis of diabetes. And the goal for what your A1c should be once you've been diagnosed with diabetes for most people is between 7 and 9, but it depends on your other medical conditions and your age. And your goal A1c is something that you would set in conversation with your doctor. And then we did
Molly,
touch on...
if I can jump into the question. So what would indicate that someone needs that A1c test? Is that going to be recommended by a doctor? Is that something that someone's going to do as just sort of part of their routine yearly physical? What sort of indicators are you looking for when someone would need that test?
That is a great question. So an A1c will be ordered probably at your physical if you have any risk factors for diabetes. So if in talking to your doctor, it turns out that your diet is high in sugar and processed foods and you don't exercise and your weight is high or your blood pressure is high or your cholesterol is high or you have family members with diabetes, if any of those risk factors are present, you'll probably have your A1c checked. And an A1c is something that we can check, over the years because if you have risk factors, it can sometimes be checked annually. And then these other monitoring things I did touch on briefly. So the microalbumin, which screens for kidney disease or protein in the urine, the foot doctor, like I mentioned, your cholesterol should be checked regularly. And you'll want to see the eye doctor regularly to make sure there's no damage to the blood vessels that supply the retina on the back of the eye. And then it's also important to make sure you're seeing your doctor regularly to control the other risk factors and like blood pressure, weight, smoking. And then everyone with diabetes, it's recommended that they get an ammonia vaccine and a yearly flu vaccine because having diabetes, especially if it's not well controlled, can put you at risk for a pneumonia or a flu infection that's much more severe than it would be otherwise. So this is like a good idea of what a healthy plate looks like when you have diabetes. Half of the plate is non-starchy vegetables, lots of leafy greens, spinach, carrots. A quarter of the plate would be some form of lean protein, and the other quarter of the plate can absolutely have some carb in it, especially if it is, a whole wheat pasta or whole wheat bread or brown rice, or something that, has, because those whole wheat carbs don't cause as sharp spikes in your blood pressure. These are all things that have sugar in them and carb in them, but the sugar that you're going to get from whole wheat pasta or blueberries, for instance, doesn't have as bad effect, nearly as negative effect on your blood sugar as something like cake or candy or more processed sugars do. You can see that there's probably a lot of sources of sugar, even though you don't think of this as like a sweet meal. because there's probably, some processed sugar, added sugar in the pepperoni. You have some added sugar in the patty, and also, of course, in the crust of that pizza. Some more high carbohydrate meals, and this kind of carb is just it leads to a much sharper and more rapid blood sugar increase than do the healthier carbs like fruits and vegetables. Here's just another.
We're not recommending the burger inside a pizza inside a pizza.
I'm definitely not recommending it. Yeah. Pizza on occasion is definitely okay. If it's a whole wheat crust or a cauliflower crust, even better. You never have to like give up everything that you like. But just being mindful of healthy carbs versus processed, less healthy carbs.
Is the key with this, right, is sort of what those foods are gonna do to someone's blood sugar.
Exactly. Right? Exactly. Yeah, like the more processed sugar, carbohydrates just send your blood sugar straight up really fast in a way that's much harder to control, whereas the carbohydrate or sugar that you get from an apple leads to a much steadier release that is much easier to control. Anyone want to guess how much sugar is in a 20-ounce Coke?
I'm afraid to guess. I know it's a lot.
It is a lot. 16 teaspoons, which is the equivalent of 12 cookies, or 8 cups of strawberries, 3 slices of pizza, or 6 tablespoons of peanut butter, or 6 Big Macs, or 3 Boston cream donuts. So there are absolutely things that you can do to prevent and to treat diabetes. Once you're diagnosed with diabetes, making lifestyle changes can still be extremely helpful in controlling your diabetes and can sometimes even prevent you from having to need a medication to control it. So the first thing is diet, making the shift to, minimizing your intake of processed, unhealthy carbohydrates. Quitting smoking is really helpful. And then exercise and weight loss can help not only lower your blood sugar, but make your body more sensitive to insulin, and can, if you have prediabetes, absolutely prevent you from developing diabetes. And it doesn't have to be a crazy amount of weight. Even like 5% of your body weight can make a really big difference in lowering blood sugar and increasing your insulin sensitivity. And the amazing thing is, there's some good data to show how helpful exercise is in preventing diabetes and controlling diabetes, both in terms of aerobic exercise like walking or running or things that get your heart rate up, and more resistance or strength training, like weightlifting or body weight exercises. And it's also recommended to do some flexibility and stretching and balance training that can be really helpful. And the balance piece can be really helpful in preventing falls as well. And it's best to combine all of these. And just walking 10 minutes for 10 minutes after eating a meal can bring your blood sugar down by 20%, which is pretty amazing. So I encourage everyone to walk as much as they can. And then there's a bunch of different medications for diabetes, some of which you've probably heard of. There's metformin, which a lot of people take. There's glipizide, sitagliptin. There's a lot of Flozin medications. There's pioglitazone, which is not really used anymore. There's a bunch of medicines that end in glutide. And there's many, many more. And then there's long-acting insulins, short-acting insulins. Those are injected, whereas a lot of the medicines, there are also a lot of medicines you can take by mouth too. But the other medications that are really important when you have diabetes, apart from the medications that lower your blood sugar, are blood pressure medications, cholesterol medications. And this says aspirin, but this is an older slide, and that's actually not really true anymore. The aspirin is only important if you have had a stroke or a heart attack in the past, or if you've been diagnosed with something called coronary artery disease. But just having diabetes alone is not a reason to have aspirin. And the cholesterol meds, things like atorvastatin, rosuvastatin, pravastatin, anything that ends in statin, that is really important when you have diabetes, even if you don't have high cholesterol. And the reason for that is because, the complications that we worry about, those macrovascular complications like stroke and heart attack, those are dangerous and scary things. And by taking a statin when you have diabetes, you can really help minimize your risk of those things, which is awesome. And when starting a new medication or changing the dose, you'll probably want to see your doctor pretty frequently so that you can make sure you're controlling the blood sugar and getting it as close to your goal as possible. So, in summary, diabetes is a disease in which there's too much sugar in the blood and you can't get it into the cells to actually use it as energy. It's a very, very common illness, especially as you get older. The risk factors are mostly things that you can control. The things that we can't control are age and family history. The things that we can control with diet and exercise are how we eat, our weight to a certain extent, smoking, our blood pressure, and our cholesterol. And the reason that diabetes is so dangerous is because it can have pretty negative effects on your eyes, your kidneys, your heart, your nerves, your brain, your circulation throughout your whole body. The two main ways we monitor blood diabetes are with checking blood glucose levels with a finger stick throughout the day or throughout the week, depending on what you and your doctor have decided on, and a hemoglobin A1c, which measures how well your diabetes is controlled over the last 3 months. And there are many options for treatment, and it's most important to do a combination of, if you can control it with diet and exercise alone, that is amazing. And a lot of times people need additional medication too, and that's okay. But continuing those lifestyle changes like a healthier diet and a little bit of exercise most days of the week will only help things. And now I'm happy to take any questions or comments that anyone would like to share.
Great, thank you, Molly. And I'll give folks a chance to put things again, either in the Q&A or in the chat, or if I see there's a hand raised, I'm happy to let someone ask their question. Jimmy, if you want to ask your question, you should have an option to unmute.
Yes, I did. Can you hear me?
Yeah, go for it, Jimmy.
Okay, great. Not too much information, but about a year and a half ago, I developed neuropathy. I'm also HIV positive. I at first thought, well, perhaps it's because of my HIV medications, but I am in a generation of HIV meds that apparently do not necessarily cause neuropathy since I was diagnosed in 2002. But I was also told recently that I'm pre-diabetic. So I have to wonder now if my neuropathy is actually a form of the diabetes and not anything to do with my HIV. Is that possible?
I suppose it's possible, but it is unlikely because if you have pre-diabetes, that would mean that on average, your blood sugar is not high enough to cause neuropathy. But there are a lot of different things that can cause neuropathy. You can have neuropathy if you have some arthritis of the spine or in the neck. But if it was, depending on how recently it was that you were diagnosed with pre-diabetes, it could be worthwhile to ask your doctor about getting a repeat A1c checked.
Okay, thank you. That's what I'm thinking I got to do. Thank you very much.
You're welcome.
Jimmy. One of the questions I had, Molly, so you showed that chart with sort of the for the A1c, 5.7 I think was ideal, and then you had the 5.7 to 6.5 being pre-diabetes. Are people ever able to sort of move down on that? So if you're in that pre-diabetes range, are you able to kind of get your levels down below 5.7 again, so where you would no longer have pre-diabetes? Or can type 2 diabetes ever go back to being pre-diabetic?
Yeah, absolutely. And you can even sometimes get that number down into a non-diabetic range with diet and exercise alone if you're really diligent. And sometimes, or the combination of diet, exercise, and medication can get that number much lower. Once you get above a certain age, we don't want it too low. If you've had diabetes for a while and you're older or have like a lot of other medical conditions, then we wouldn't really want your A1c lower than 7, because when it's lower than 7, we worry about your sugar dropping too low, which is also dangerous. So it's kind of about finding that sweet spot, but having prediabetes is absolutely reversible.
Thank you. All right, Mark, I'm going to give you permissions here. You should be able to unmute and ask your question. All right, go ahead, Mark. Mark, you should be able to ask your question. I gave you permission to be able to speak, so you can ask your question now if you want. All right, we'll come back to Mark if you want to ask your question. Someone came in the chat just saying the medication review is helpful, and that there are so many meds being added every year, and other minerals. So I guess if there's anything to say on Molly on sort of the changing medications, because it does seem like there's always something new being brought to market.
Yeah, there's so many medications. Metformin is kind of a staple. Most people who have diabetes will be on metformin kind of forever, because that's just really helpful with the insulin resistance that you have in type 2 diabetes. And then there's so many different classes of medications, and which one is going to be right for you is going to depend on what other health conditions you have and how you've responded to other things. And more and more, there are new injectable medications, which are just once a week, which can be really nice, so that you're not having to inject things every single day. And those medications tend to be really helpful in lowering your A1c. And part of the thing with these medications is many of them are so similar to each other, and which one you end up on within a certain class will sometimes come down to which one of those your insurance is willing to cover. And that ends up being okay, because they tend to be very, very similar.
And then another question that came in, that's a great question. Any signs or research being done towards a cure?
That is a good question. I think, in type 1 diabetes, the ultimate cure is a pancreatic transplant. There are definitely people who have those, but it's not first line and it's not commonly done. It's a difficult procedure, and I think it's by no means mainstream. And then I think the cure for diabetes really comes down to if we can control risk factors like weight, diet, exercise, smoking. That would cure type 2 diabetes.
All right, Mark, we're going to try this again.
You hear me?
Yes, we hear you.
Oh, good.
You have the floor, Mark.
Okay. I'm almost 79, and a year and a half ago, my internist took me off diabetic medicine because he said the numbers changed. You used to have to be below 7.0, and now at this age, you have to be below 8.0. Mm-hmm. So it's been wonderful. My home readings many times are in the 120s, which they had never been when I was on glyburide. And I've been scoring. The 3 months after he took me off, I was 7.7, then I was 7.6, then I was 7.5, then 7.4, and I seemed to go around 7.5. And it seems to have been great. My readings, when they take the blood tests at the offices, I'll come in at 160 below 180. So I was thrilled, and I think many doctors would say, well, they're on it and it's working, don't do anything. I'm so glad my internist took me off.
Yeah, that is really, really nice to hear. That's excellent.
So I just wanted to share that.
Yeah,
thanks,
Mark. All right, I see another hand up. Jeanette, I'm going to give you speaking permissions if you want to come in and ask your question.
It's not actually a question. I just went to my doctor like last week, and my A1c was 700, and she told me that was too high. So it's like 6.1 now. What's the difference of it being high than being low?
For the A1c?
In terms of
Yes.
symptoms?
Huh?
In terms of symptoms?
Yeah.
So when your sugar is too high, you get really dehydrated, thirsty, can get kind of confused, nausea, vomiting, blurry vision. When it's too low, people tend to feel more like really shaky and a little bit faint. And when it is not stable, or it's going high and then low, you kind of alternate between those two.
No, what I mean is that when she tells me that my A1c is too high, like she says she don't want it to go over 7. Okay, so now it's 6.1.
That's great.
Is lower being good or higher being good? Because she tells me that if it's over 700, that's not good. Because she
Go
upped
ahead.
my triglyceride. I was taking 0.75, now I'm taking 1.5.
Okay. So with A1c, as you get higher, it shows that your diabetes is, poorly controlled. So generally lower is better, but it's about finding that sweet spot. And as you get older, we don't, the goal for where we want your A1c changes. But generally, the higher it is, the worse your diabetes is.
Okay, that's what I wanted to know. Okay.
Got it.
Thank you.
You're welcome.
Thanks, Jeanette.
Mm-hmm.
And then the other question from Rob is A1c really our friend? So I would take that, Rob. Is that a question of sort of is A1c an accurate measure? You can let me know if I misinterpreted that well. But I guess is there debate on if A1c is really the best measure?
A1c is a really, really good, very accurate, very sensitive test.
Okay, great. And the other question I had, going back a little bit, so in the pre-diabetes, because that's a big statistic. I think it was like 40% of people have pre-diabetes. At that time, are you prescribing any meds, or are you really looking at, let's get cholesterol, blood pressure, the other risk factors under control?
Exactly. Yeah. No meds at that point for most people. Very rarely are you on meds at that stage. It's all about diet, exercise, getting your blood pressure under control, losing a little bit of weight, and getting your cholesterol under control.
That's great. Jeanette, I saw your hand go back up. Did you have another question? Oh, it went down. Great. I'm just going to give it a minute to see if there are any other questions coming in. Folks are free to raise their hands or put things in the chat or the Q&A. But I'm still thinking about that pizza burger, Molly. I know that wasn't the right takeaway from this, but it does just show how much of the foods that are out there have all of these fatty ingredients and the processed sugars. And
definitely.
It's a common theme for folks who've been to many of our Doctors In programs. I feel like almost every health condition, right? We're talking about nutrition, getting more vegetables, cutting out those overly processed foods, and then getting the exercise of the even just if it's walking throughout the day.
Exactly.
Right. Well, I don't see any other questions. Oh, Jeanette, I see your hand again. Do you have another question?
Yes, I do.
Go for it.
When you're diabetic, like type 2 diabetic, does that causes a lot of pain in your body? I mean, do you go through a lot of pain and stuff in your body, like neuropathy, sciatica, stuff like that?
Yeah, it doesn't generally cause pain. It doesn't cause sciatica. If it things like being overweight or having some weak muscles around your core, those can definitely put you at risk for sciatica. But it can definitely, if untreated over a long period of time, can cause neuropathy.
Okay. Because I'm
and
going
that
through that
neuropathy would cause pain.
neuropathy. Right? I'm going to have neuropathy now, and it's very painful.
Yeah, neuropathy is really, really painful.
And it just seems like as I get older, it gets worse.
Yeah.
So what do I do?
Yeah, Molly, are there any recommended treatments for neuropathy, or at least to reduce the pain?
There's a bunch of different medications that can be helpful. I would definitely suggest talking to your doctor if you're not already taking something for the neuropathy about which of those medications would make the most sense and be safest for you.
Well, I can't take gabapentin. They tried to
Okay.
put me on that. I can't take that, and they haven't put me on anything else because I'm really going through a lot of pain, and I'm going to be 65 next month, so it's really hurting me.
There are other
like I used
medications
to.
too. I would definitely encourage you to ask your doctor about medications like Lyrica or Cymbalta or other medications that can be used for neuropathy.
Okay. Sounds good.
Thanks, Molly. Thanks, Jeanette.
And
then the other question that came in through the Q&A, and you had mentioned this a bit, Molly, but how does smoking enter the equation? So knowing that it's a risk factor, and that ideally folks would quit smoking or reduce their smoking, but knowing that that can also be a hard thing to do.
Yeah,
So how much? And I know there are many different factors, but how concerned would we be about smoking?
The major concern is that what makes diabetes dangerous is its ability to damage your blood vessels, and that's what smoking does as well. So when you combine those two things, it puts you at much higher risk of having complications from diabetes, especially as it relates to having poor circulation.
And then I guess on a maybe similar related, that ideally we would all be eating that very healthy plate, but knowing sometimes in this case the comment was on fried food. Something that ideally we would be cutting out, but knowing realistically there's a lot of things that are fried. So anything you understand that and sort of how to balance getting healthy, but also knowing that we may still be wanting to enjoy certain foods.
Yeah, I always tell people that there's nothing that's off limits. There's no bad food. It's really about moderation and making sure that like at least 80% of the time you're eating in a way that is healthy and limiting processed foods, but it's not an overnight change. It takes time, and you have to kind of educate yourself, and you're gonna have lapses where it's really hard to maintain, but finding a way, whatever works for you, to kind of hold yourself accountable and kind of connecting it in your mind to long-term health and preventing long-term complications.
Right. That's great. Thank you. Well, thank you everyone so much for joining us and for the questions. And of course, thank you, Molly, for taking some time to share all this information and the tips and best practices for folks, both to reduce the likelihood of diabetes or to most effectively manage their diabetes. So thank you, and we hope to have you back to another Doctors in the future.